There aren't too many leukocyte disorders. The first word isn't really a disorder, it's just a term. Leukopenia refers to the fact if you had too few white blood cells, and this might be due to if you were taking some certain pharmaceutical drugs, like maybe anti-cancer agents, and that was if your white blood cell dropped below, say, 5,000 white blood cells per microliter. That would be bad because that would compromise your ability to fight off infection. So that would be bad. And I bet you've all heard of mononucleosis. This is a disease that's bad. You've probably all had it, and maybe you were too young to remember it, but it's caused by the Epstein-Barr virus. And the next slide is just a fun slide. I'll show you all the symptoms. We'll go ahead and get to that slide. But it's caused by the Epstein-Barr virus, and what you see are many abnormal agranulocytes, particularly the lymphocytes if you're looking at the blood. So let's get to that slide, and I'll go ahead and show you. I can get to it. Uh-oh, where's my slide? There it is. So in mono, if you've had it, some things that you might feel tired, really tired, even for months. It's horrible. You don't feel like eating. You get a headache, sore throat, you get a cough, fever, chills, aches. You just feel horrible. And it could go on for months and months and months. Some complications, you might have an enlarged spleen, abdominal pain, stomach problems. But overall, you just feel horrible. And oh, yuck. Okay, so that is a really up close. You get a really bad sore throat, and your tonsils swell, and you get nasty white patches in your throat and on your tonsils. These are the palatine tonsils right here, and here's the back throat. Ooh, I don't even want to know what that is stretched across there. And here is a picture of someone's blood that has mono, and those look like crazy blood cells, right? Those are actually lymphocytes, atypical lymphocytes that you see in someone's blood. They usually have an elevated lymphocyte count. It represents like at least 50% of their white blood cells, and then they have these weird lymphocytes that you see a lot of cytoplasm, and they look like this. They kind of look like monocytes, but they're the lymphocytes. So let's get way back here. So if you've had mono, you definitely remember it. And leukemias, that's our next white blood cell disorder. And with the leukemias, it literally means white blood, because with leukemia you have an increase in the amount of white blood cells. You have a lot of white blood cells being produced, because that's what cancer is. Cancer is an overgrowth in a certain type of cell. But in this case, usually cancers, you produce a tumor. In the case of leukemias, you have cancer of the blood, but you don't have a tumor anywhere. What's happening is inside your bone marrow, you have overproduction. You have way too many really bad white blood cells being produced. So you would think, well, I've got lots of white blood cells, excess white blood cells. If I have leukemia, am I going to fight infection very well? No, because the fact that these white blood cells that are being produced are abnormal. And so someone with leukemia, their problem is that their white blood cells, they're abnormal, and so they have problems fighting off infection. That's one symptom of leukemia. Another symptom of leukemia, more than just not being able to fight off infection, those abnormal white blood cells, they crowd out all the bone marrow. So they crowd the hematopoietic stem cell, and the hematopoietic stem cell can't do its job. And so you end up with anemia if you have leukemia. And so you have all the symptoms of anemia, being pale and chilly and cold and all those normal symptoms of anemia. And then in addition to that, because it's crowding out the bone marrow and that hematopoietic stem cell can't do its job producing the platelets. So with leukemia, you end up having bleeding problems. You end up bruising a lot and just having typical bleeding problems. And you also have problems with your white blood cells. You can't heal. You end up having fevers, and there's weight loss involved. So leukemia has quite a bit of symptoms, and it all revolves around the fact that your bone marrow is being crowded by all these atypical white blood cells, these abnormal white blood cells. So there are different types of leukemias, and they all have to do with the stem cell that's involved. Now, let me see here. Where is that picture? Oh, it was behind it. If you recall, when we make our white blood cells, our lymphocytes come from one stem cell and all the other white blood cells come from another. So we have our myeloid stem cell and we have our lymphoid stem cell. We have two main types of leukemias. We have the lymphocytic leukemias that are going to come from this stem cell, and we have the myelocytic leukemias that come from this stem cell. So if someone has a myelocytic leukemia, it's because one of these types of cell, any of these types of cells went bad. They mutated, and then they started producing progeny that just crowded out all of the bone marrow. If they have a lymphocytic leukemia, something went bad from this stem cell, from any of these cells here. And then they just started producing cells that crowded out the bone marrow. So there's myelocytic leukemia and lymphocytic leukemia. And then there's acute leukemias and chronic leukemias. Acute leukemias tend to target children. Children tend to get those types of leukemias. And acute always means it's fast acting. It comes on strong and fast. And then chronic leukemias tend to affect the elderly. They come on slow and they tend to progress at a slower rate. Now, blast cells, these guys right here, these tend to produce the acute leukemias. So if someone had, say, acute lymphocytic leukemia, that's probably because this cell right here went bad and started producing a bunch of bad cells. If they had acute myelocytic leukemia, one of these cells would have gone bad. If they have a chronic leukemia, then it's a site type of cell, one of these types of cells that have gone bad. So if they had a chronic lymphocytic leukemia, it would be this cell that would have gone bad. So again, myelocytic leukemias come from the myeloid stem cell, lymphocytic leukemias come from the lymphocytic. And acute, it's called acute if the cancer originates from the blast cells. It's called chronic if they come from the site cells. Now, treatment for the leukemias, you have to go into the bone marrow. You have to irradiate that bone marrow. You have to get rid of the bad bone marrow, and you have to replace it with stem cells. You have to put all new. You have to do a stem cell transplant. You have to get rid of the bad and put in with a new. Now we're on to hemostasis disorders. So this really has to do with blood clotting. We're off of the white blood cells altogether, so we're changing into a totally new direction. We've done red blood cell disorders, we've done white blood cell disorders, and now we're basically onto the platelet side. So our first disorder we're going to talk about are thromboembolic disorders. And these disorders have to do with clotting when you shouldn't. So our first definition is a thrombus. And I'm sure some of you have heard of a thrombus before. There's a difference between a thrombus and an embolus. A thrombus is a clot that forms in the wrong place. And where is the wrong place? It's in a blood vessel that has no damage. So say you're sitting and you're immobile for too long of a time, maybe in an airplane, maybe laying on your couch for too long, whatever you're doing, you sit there for too long and procoagulants build up, and you have all the right stuff in the right place for a long time, and you have maybe not too smooth of an endothelium, and a clot will form there. That's a thrombus. Now, if part of that clot takes off and starts through your blood, starts flowing through your blood, that's called an embolus. So this is a clot that's on the move. So a thrombus is when it forms, and if it starts moving through the blood, that's why we call it an embolus. Plural of embolus is emboli, by the way. But an embolus that's on the, this is flowing freely through your blood. Now, if this embolus is traveling through your blood and it gets to a narrowed place, say you have a buildup in your heart, you have a blood vessel that's been narrowed through years and years of inactivity and plaque has built up. If that embolus gets wedged in your heart in a smaller area, and that clot gets stuck, then it's called an embolism. And then you have a heart attack, right? Excuse me. If it gets stuck in the vessels in your lungs, it's called a pulmonary embolism. I'm sure you've heard of this before. If it gets stuck in the brain, it's a cerebral embolism. So I'm sure you've heard of the term embolism before. This is the clot that forms in the wrong place. If it's on the go, it's called an embolism. When it gets embolus, when it gets wedged somewhere, it's called an embolism. Very important terms. Now, these are conditions that enhance your chances of forming an actual thrombus. If you have hardened blood vessels, if you have inflammation in your blood vessels, or if your blood is allowing to be pulled in a certain area, that enhances the chance of a thromboembolic disorder. And these are drugs that we take to prevent developing a blood clot, and the reasons they help. Like aspirin inhibits thromboxane A. And if you'll remember, thromboxane A is a substance that our platelets release when they degranulate, and thromboxane A enhances vascular spasm and other platelets to come and help with platelet plug formation. So aspirin prevents blood clotting. Heparin is a substance that we take to inactivate thrombin, and if you'll recall what thrombin does is thrombin activates fibrinogen to form fibrin, and so that would help prevent blood clotting. And warfarin is also called Coumadin. I think we call it warfarin if we give it to rats, and Coumadin if we give it to humans. But warfarin and Coumadin, what they do is they inhibit the synthesis of our vitamin K dependent procoagulants, and we have 4 procoagulants that our liver produces that depend on vitamin K. And so if we take this, we have to take this as a shot, but it will act as people call these blood thinners. All of these blood thinners, they act as blood thinners. They prevent the production of a thrombus. Now, on the other spectrum, a bleeding disorder is, wishing you could clot. You bleed and you bleed and you just wish you could clot. So these are different types of bleeding disorders that we're going to talk about now. The first one, thrombocytopenia, means few or poor thrombocytes, few platelets, thrombocytopenia. This is really bad. Thrombocytopenia means when your platelet count drops really low, like below 50,000 per microliter. That's really super bad. And the sign for this is petechiae, little tiny purple patches everywhere. Petechiae is a word you should know. And this is actually a word that you should know as well. Of course, anything that I teach you is a word you should know, but that doesn't always turn out that way, does it? Okay, so thrombocytopenia is when you have a really low platelet count, and it can happen with anything that suppresses your bone marrow, because in your bone marrow you have that hematopoietic stem cell that is producing your platelets, right? So anything that affects your bone marrow is going to affect that hematopoietic stem cell. Drugs, an infection, radiation, cancer. I knew someone who had a simple cold. Well, it wasn't so much a simple cold. It was a little more than a cold, but to her it felt like a strep infection, and she got over it, and like 2 days later she ended up in the hospital fighting for her life with thrombocytopenia, and she ended up there for a week and ended up in a coma. It was crazy. So, okay, enough of that. Impaired liver function. You know how important your liver is. It makes all kinds of proteins, but the important proteins for this topic would be the procoagulants that your liver makes that helps you clot. If your liver's not working and it doesn't make procoagulants, you're not going to be able to clot. I like to remember this by any show on VH1. If you watch all those drunk women going around drinking, etc., they're bruised all over the place. And that's not just from falling around, falling down. They're drinking all the time, they're impairing their liver. That hurts your chances of procoagulation. So think of the drunk women on VH1. But also, if you have a vitamin K deficiency. If you have a vitamin K deficiency, remember that your liver needs vitamin K to produce those procoagulants. And sometimes if you take a massive bout of antibiotics, that can give you a vitamin K deficiency because our bowels are full of bacteria which produce vitamin K and help us with our vitamin K amounts. All right, hemophilia. Now, I'm pretty sure you've all heard of hemophilia, which is a hereditary condition. You surely know if you had it. There are different types with differing severities. We've probably all heard of the most severe type because, back in the 80s and 90s, lots of hemophiliacs were developing HIV because the treatment is transfusions. And also they get replacement of their missing procoagulants because hemophiliacs, this is a hereditary condition where since they're missing procoagulants, they can't do that normal chain of events to coagulate. So they end up with prolonged bleeding times, they bruise a lot, and they bleed into their joints. So just to live a normal life, the ones with the most severe hemophilia have to have normal blood transfusions. And so lots of hemophiliacs were ending up with HIV. So that's how most people heard about hemophilia in the first place. And so that's what hemophilia is all about. But there are mild types of hemophilia as well. So those are on the bleeding side of it. Many people are free bleeders. These are the ones in the book, but you could have problems with just your platelets, and these are okay. Disseminated intravascular coagulation. This is a strange one. You have widespread clotting and severe bleeding at the same time, this has to do with sometimes you'll develop clots in unwanted places, and when you do that, you use up all your procoagulants, so then you'll start hemorrhaging in other places. So the best example of this is it does occur in pregnancy. So what if you have clots occurring all over your body because you're pregnant, and then you start giving birth? What's going to happen when you give birth is you're going to hemorrhage drastically because you've already used up your procoagulants, and this is a very serious situation, disseminated intravascular coagulation for pregnant women. So that's why you need to know this term right here. All right, that's it.